Hello everyone, it's Dr. Warren from Kalkstein Chiropractic. Welcome to Clinical Series Episode 2. Last episode, if you didn't catch it, we talked about tension headaches or cervicogenic headaches, one of the most common types of headaches that we'll see in our office. And today we're going to talk about migraines and what they are, what the signs are, what to do about them, what you'll have in terms of an experience if you go to a doctor's office and you have a migraine. So let's talk about what migraines are. So Tegan, did you know there's two types of migraines?
No.
Now you do. Common is an occurrence, and then there's a classic. So classic is when you have aura, or that there's a visual disturbance in an eye. Usually it's one eye, where there will be some type of something in the field of vision, like a blur, or you might see some black spots, or there actually might be some changes in the eye movement itself. And then you have common. Common is without aura. So that's the most common classic type. There's 80% of the migraines that we see are going to be without aura. And let's talk about what these things are. So there's theories out there in terms of what a migraine is or what can cause it. A lot of causative factors when it comes to migraines. I'm going to sit down and talk about them because there's just quite a few. Let's see. Okay, there's the stress theory, basically. There's a theory that it's related to more of like a sympathetic overdrive into the brain, so you're just really stressed out. There's a theory revolving around like venous supply of blood, so there's poor perfusion of blood in around certain nerves, and it causes these things to occur. And then there's the stimulating theory, and so that there's something in the environment or something during the day or some type of stressful event that always triggers these migraines. Okay, so let's talk about that a little bit. You got to look at a broad range of things when it comes to migraines. You got to look at diet. If there's anything inflammatory or something that's causing, as a causative factor in the foods that you're eating. Some common ones that people talk about it can be like tea and coffee, or it can be red wine or certain cheeses that have certain types of chemicals in them that create a little bit of a response in the body. And then you also can have factors that cause migraines like stress, anxiety. One of the biggest relationships between migraines and in terms of what's a causative factor is people that have type A personalities, people that are really a little bit higher strung. So if you kind of feel like you're in that kind of category of people and you're getting migraines, stress relieving activities is a really nice way to calm those down. It can be cyclical in nature. It can come once a month for females. More common in females to get migraines than males. Quite a bit more common. They tend to happen at a younger age and get better as you get older. That's a common occurrence in migraines. So what happens? Someone comes in, they've got unilateral pain in the head. It's cyclical. It's usually a stressful event that causes it, or it comes in certain times. The first thing that they get is this sensation or blurry vision. It's called a prodrome to the migraine, and then they'll start to get that headache, right? That really painful headache that's debilitating. They tell me that sleep is something that really helps them calm it down or rest. Or there's some type of activity that they know that they can go do, because you got to figure it out on your own sometimes. So I get someone that comes in with that. One, I got to rule out red flags. I need to make sure that it is coming from one of those kind of systems in terms of that nervous system overdrive, that there's not something that's more sinister going on. And I can rule that out if need be through imaging, through a really good history, and through a trial of care if need be, right? Those are factors that would allow me to do that. I need to make sure it's not a cervicogenic headache. Like Tegan gets those cervicogenic headaches or tension headaches. How did you feel after we worked on you last time?
I haven't had a headache since, so
that's awesome.
I'm doing a lot better.
She's in the gown today because she said she felt a little tension in her upper back and neck, and I told her I would dry needle her today, but first we got to do episode 2. We're doing it.
5-minute time limit, Dr. Warren.
Oh, what time is it?
4:40.
4:40. I got 20 seconds. So, what can we do here to help out with migraines? One, diet is really important. To understanding diet, we have a nutritionist on staff that can help us do that. Number 2 is treat tension and stress in the upper cervical and thoracic spine. That can really help out calming down the nervous system's stressful response to whatever stimuli is stressing them. Even if it is hormonal, people still come in, they get treated, they get dry needled, they get soft tissue work on the neck, and they feel really good. That helps with their symptoms, with their pain, and when you can help someone with a migraine, it's life changing for that person. So I love treating migraines. I think that they're really interesting because it's a more complex puzzle sometimes, and that fascinates me. But So diet, rest, making sure that mindfulness is a part of their daily activity, making sure that they're doing stress-free activities like yoga, Pilates, exercising, strength training is really nice too. So balancing that for whoever the person is that's coming in to see us. And I know I'm over 5 minutes, but I think this is an important topic. Yeah, studies certain. So really, very rarely do I want to do imaging on somebody with migraines. It's not going to give me any information in most cases unless it's from a different source. In terms of orthopedic tests, there's something called Sperling's test that really rules out other things like a cervicogenic headache, where there's lifting of the neck or there's pushing down on the neck to see if those structures are irritated. And someone that has a true migraine, that doesn't really set them off. And then when I work on somebody here in the office, I make sure that the atmosphere is comfortable for them, that they're relaxed, the lights are dimmed. I do soft tissue work, we do dry needling. All three of us are really fascinated and interested in working with migraines. So if you have anybody that, one, doesn't understand their migraines very well, or they want more information, I'm going to do another video a little bit longer where I treat someone with a migraine. And we'll talk a little bit more about some of those stimulating factors that can be the cause of the migraine. Oh, also, hypoglycemia. So if you are someone with migraines and you skip meals, that is not a good idea. You need to make sure that you are continually eating a normal regimen of a standard diet throughout the day. If you're not eating, that can affect your blood sugar levels, which can affect some of these symptoms in migraine. So consistency with meals, really whole foods, and no processed foods, no dyes, no additives that really can be stimulating for someone with migraines, especially if you're already sensitive in general as your system can be with someone that gets migraines. So yeah, maybe eating processed foods doesn't affect everybody, but that's not the point. It's really if it affects you. So mess with the diet a little bit. Really, it makes a big difference. We see it all the time. Okay, that was a good one. I don't care if I went over 5 minutes. I like talking about that stuff. Are we still filming? Thanks for watching, everybody.